Hello, I am here to say something concerning depression and mental health during the time of isolation and quarantine. It's one thing when you suffer from depression on the norm. It's another thing to have to deal with being isolated from people, not being able to go to therapy, and people with BPD tend to struggle a little more. I was just informed by my therapist that a lot of movies portray borderline personality disorder as, this, as people just seeking attention because that's the way they have it in the movies. I wouldn't know because I don't really look at TV shows or stuff like that. And she made a very valid point because a lot of people that I know thinks that I am just an attention seeker. They don't understand that rejection, abandonment, isolation is real. Borderline personality disorder is a very complex mental disorder. You have to be really trained in how to deal with that. And then if the person have other issues and conditions with it, it makes it even more complex. And my doctor said something yesterday that depending on what may trigger someone with borderline personality disorder, they may have some traces of behaviors that is classified schizophrenia. That bothered me when she made that statement. It's one thing to try to say I have bipolar, and I fight that tooth and nail because I really don't know. And I'm sorry that I look like a plucked chicken, but I've been struggling being in this house, and I don't know how to reach out to people. Yeah, I try to practice this thing, the half smile. And even with doing this isolation thing, it landed me in a DBT group. And a lot of people don't know too much about PE. But after having, I guess, a little psychotic moment in my session, I've landed myself in a PE session, which is an hour and a half long, very intense, very detailed in whatever. And most people tend to not be able to make it through it. Some people may wind up in a hospital. Some people may drop out of it because it's too emotional and you will go through some really bad situations. And it can be beneficial if you allow yourself to use skills that you learned in group. Previously, I spoke about making sure you find the proper type of therapist that deals with borderline personality disorder, because most therapists will walk away from it because they don't understand it. Having people that are trained to deal with your unique ways. People like to say crazy ways, but I use the word unique because I am unique in my own way. Very intelligent, as they say. Right now, I don't feel intelligent with anything. However, the next time that I do decide to come on here, I probably won't have a smile on my face at all. And as I was told, I have to validate everybody else's feelings because it's not always about me when I break down and cry, because a lot of people will either hang the phone up on me because they can't handle it. They don't understand why it may happen. And sometimes I don't even understand, but I do know that I don't understand a lot of people's logic in the way they handle me. There's one lady that I call my mom because she doesn't understand me. She tends to run from me, and from a distance she'll pray for me. And that hurts because my own birth mother is not there for me doing when I needed her when I was younger or even now. So, yes. Is this a difficult time? Yes. Is it more difficult for me? Yes. I suffer with bronchitis, asthma, and allergies. I cough, sneeze, and all that stuff on a norm. So when church decides to open back up, they're going to treat me like I'm diseased or whatever because of what's going on in the world. Yeah, we're in the yellow zone, whatever the case may be. But people going to forget that you already normally, by the time you walk around the corner, you're suffering. You can't breathe and you're coughing and everything like that. So that's why I stay in the house, because I don't want nobody thinking that Rona decided to visit me and everything like that. I wish people would understand that this is what I go through on the norm. Okay, so yes, depression is real. Don't let nobody tell you that you don't have the right to be depressed when you're feeling depressed. It's okay. It's okay to cry. But you have to also validate those that may pull away because they have to deal with themselves to get them together and to understand that they're not walking out of your life. They just may need a break. And even though you may go through that rejection or abandonment issue, just know that if they're a true friend, they will be there. They're not going to walk out your life if they truly care about you. Okay? So, keep your head up. And if you get depressed and if you're one that likes to upload things, please try not to make yourself look like you've been tore up from the flow up. Most people can't tell when I'm depressed because I tend to try to keep a smile on my face or tend to keep a scarf on my head so no one knows that my hair is tore up. Yeah. I'm going to go make an effort and do something, not so much for me. It should be for me, but so nobody questions me because nobody's going to understand, you know? Most people don't understand people's struggle. And if you don't understand your own struggles, you can't expect no one else to understand you, okay? So don't feel bad when people say certain things. Validate your feelings, understand your condition, and treat your condition the best way you know how.